Bioidentical Hormone Replacement Therapy, or BHRT by Biote, is one of the most advanced approaches to hormone optimization and healthy aging available today. As we age, our hormone levels naturally begin to decline. That decline can affect nearly every aspect of how we feel, from our energy and metabolism to our mood, sleep, mental clarity, and overall well-being. If you've been feeling more tired than usual, noticing changes in your body, or simply not feeling like yourself, hormone imbalance may be playing a role. At RefinedMD, we take a personalized approach to hormone optimization. Every treatment begins with a comprehensive consultation and laboratory testing, allowing us to understand your body's unique hormone levels and create a treatment plan tailored specifically to you. Because no two patients are exactly alike. One of the key advantages of the Biote method is pellet therapy, which is designed to provide a steady, consistent release of bioidentical hormones over several months. To help you better understand how this treatment works, Eric will walk you through the Biote pellet, explaining the procedure and sharing his own experience as he undergoes treatment.
And can I please just get your signature over here?
This is how it all starts. Sign it away. Great, I'll let you do the date.
Perfect.
Thank you. My name is Eric, and I am the practice administrator at RefinedMD. And one of the treatments I'm going to do today for myself is to get bioidentical hormone replacement. We partner with a company known as Biote, who make specialized pellets, either testosterone or estradiol, that we implant just beneath the surface of the skin.
This is the trocar we use to insert the pellets, and here are the pellets here, which I won't touch. But that all comes as a sterile, disposable system. So let's get started.
These pellets address patient conditions such as fatigue and lack of energy, difficulty sleeping, reduced mental focus, memory and brain fog, mood swings, anxiety and depression, stubborn weight gain, muscle and joint pain, and reduced sexual desire. I'm actually the typical patient that can benefit from this treatment, and today I'm going to see Dr. Swengel and have him implant some of these pellets just beneath my skin. That will be a treatment that lasts 5 to 6 months. We're going to be implanting 8 of these pellets that each contain 200 milligrams of testosterone. So I'll receive a dose of 1,600 milligrams of testosterone that will last me for a total of approximately 6 months.
And these pellets are designed to basically slow release over 6 months.
And I think this is a very tolerable treatment.
Unlike pills, creams, or injections that require frequent dosing and may result in fluctuating hormone levels, pellet therapy is designed to provide continuous hormone support, helping maintain more consistent hormone levels over time. Many patients report improvements in energy, sleep quality, mental clarity, mood and body composition recovery, and overall vitality. The goal isn't simply to replace hormones, it's to help restore balance so your body can function at its best and support a healthier, more active lifestyle. At RefinedMD, we believe healthy aging starts from within. If you'd like to better understand your hormone health and learn whether BHRT with Biote may be right for you, our team is here to guide you every step of the way. Discover the benefits of personalized hormone optimization with Biote and invest in your health today.